It was scary at first, I have to admit that. No one wants to go to the ER.
Without the hard work of the people and staff at Sturdy, we might not be here today.
It started out on Saturday. It was to the point where I couldn't even stand up anymore straight. The pain was just excruciating. I knew something something was going on bad. And I figured Sturdy would be the place where I could go and they could take care of this.
It was just a chaotic day. I mean, I was just thinking hopefully it wasn't a situation where we're waiting for hours.
There was probably approximately 15 people in the waiting room there. I was put in a room at the very end, and there was 2 other people in there. It was very crowded in there, overcrowded, which is understandable because population is growing around here, but the ER isn't. And they were just trying to fit people wherever they could fit them in there.
Space has been our #1 challenge here. I think that we work with a really great team and we provide really great care. But I think that's always really kind of negated by the fact that we are kind of cramming patients in.
We are using spaces that are meant for 1 or 2 patients and squeezing 2 or 3 or sometimes even 4 patients. We've also converted the waiting room into patient care areas so that we can see patients in the waiting room. And this is great for patient flow and getting patients seen in a timely fashion, but it's not great for patient comfort and for patient privacy.
There's not a day goes by when I'm on shift, when I meet a patient in a hallway bed, that I don't apologize to that patient, because I do not want any patient to have to be in an open area and have to go through their sickness in an acute care setting in that fashion. When you're feeling the worst that you ever felt and you have to go to an emergency department, you want not only the compassion that we offer, but you want to have the environment that tells you you're being well cared for.
As busy as it was, they kept coming in to check on me and checking on the other patients. I mean, it's amazing how they can do that with the limited space they have.
Having the new ED will create dedicated spaces for all of the different staff members that will be providing care, from nursing to case management to social work to the hospitalists to the physicians, so that they all have space to be able to do the work that they need to do, have the privacy they need when they need to have private conversations, and have the ability to really complete their work in a much more modern, convenient, spacious environment.
The ED currently sees roughly around 52,000 patients a year. That volume of patients in the current size in the emergency department we have is too great to adequately care for our patients, and we continue to see expected growth over the next few years.
There was also a woman that was in there, and I don't know if she was just on drugs or something, but she was pretty much hollering and screaming.
Behavioral patients have been one of our biggest challenges. We only have 5 safe rooms for behavioral patients, and oftentimes we have 10 or 12. They're the first thing you see when you walk in the ER entrance. There's no privacy, no dignity. They're on full display.
So the new behavioral health unit is going to be a 12-bed separated unit, completely isolated from the rest of the emergency department. So the space will be quiet, it will be calm, and so it benefits the patients a lot because the reduction in stimulation will, I think, allow them to have a much more calming, healing environment.
We already have the best staff and skill mix and compassionate caregivers here in our ED. Just giving them the proper space and area to take care of these patients efficiently and effectively will certainly impact the community.
Dr. Roadhouse came in, told me that my intestine was starting to be perforated and air bubbles were going into my abdomen. Once that ruptures, to come back from that is not easy. He was going to have to perform surgery. That was a shock, because now that's a life changer. And I did start crying. It takes a lot for me to cry, but I had to accept it. And I felt comfortable. I was in good hands. I was at a good hospital. Thank God Dr. Roadhouse was my doctor, because he saved my life. I'm still here.
I would extend as much gratitude as physically possible.
If I could go back there and have everyone that was there that helped me through it all, I'd say thank you and give them a hug.